And we're live.
Woohoo! Happy Thursday, everyone. See a couple of us in. I hope everyone's having a great day. Let us know where you're coming from, how everything is going. It is just absolutely gross here in Toronto today. It's not the prettiest day. It's raining. It's just that, like, it's not quite cold, like it's chilly. That's what happens when it rains. But let us know how everyone's doing here. See a couple of great places here. I got some New Jersey, some Maryland. Hello, Austin, Texas, upstate New York. You probably having the same weather we are right now. Usually pretty common for that to happen. Oh, Indiana. Oh, gorgeous day down your way. Can I come? Like, I really wish. As I was sitting back thinking, about a week ago, we were talking about, so usually for us, we're out and about enjoying summer life when we can. It's very short here in Toronto. Sometimes can be super hot, super cold, just depends on what's happening that year. But our winter season is pretty consistent, which is just either cold, freezing, or don't go outside. And thinking about right now and like the situation we're in and where we're going to be with our winter activities, we'll see what happens. But right now it's looking a little depressing. At the same time, or maybe try to take advantage of some other winter activities. Usually we're out in the mountainside skiing, so maybe it will still happen. Maybe some skating this year instead. We'll find out. We're not there yet. But Calgary, Alberta, hello. I have family and friends out that way, both in Edmonton and in the city of Calgary, and then a little further north, and I've forgotten the name already. But beautiful New York City. Hello, everyone. Welcome. Long Island, New York. It's hot in California. I'm coming. I'm just kidding, guys. I'm not allowed to leave the country. I'm excited. A minute or two more. Let everyone settle in. I'm very excited to speak with our special guest today. Honestly, I love having Andy on. He's amazing. Some great insight to come. So as I kind of ruined the spoiler alert, but I guess I don't because he's part of the registration. But same side, I'm super, super excited to chat with him a little more about the season right now we're in. Seasonality of cold, flu, COVID is now part of that seasonality this year. So we will see how this will play out. I'm super pumped. So a couple of returnees to our webinars. Hello, welcome back. Hello. I'm excited to have you here. Hello, Hawaii. I was going to say Ola. That's not the right place here, Ria. Thursday, guys, and it's short week for me because we had Canadian Thanksgiving as well. Happy Thanksgiving to all our fellow Canadians out there. And of course, that means, you cram 5 days of work into 4. And because you've crammed the 4 days, it ends up getting crammed into what feels like 3. So it's just a wild week, guys. Wild. Hope everyone's well. Hope everyone's doing good. One more minute here. We're going to jump in, settle on in, grab your glass of water. Hello, South Africa. It's spring on your side. Yeah, I was just wondering that actually, as soon as I saw that. It's really cool. I like hearing different things from different places. Also like different foods. Guys, that's the reason why I like different cultures actually, because you guys have fantastic food. So Deborah, I'm sorry, doing well down there, doing some home improvements. That's fantastic, actually. We're doing some small things. We cleaned our locker. It was more of how much more stuff can we get in it. That's what happens, guys. At the end of the day, it's what you got to do, and you want to take advantage of it right now. You're at your place potentially for a long time, and it's important to make it feel just that much more nice. Okay. Hello, Bronx. Let's get diving in, guys. Debbie's okay. Thanks, Deborah. I'm sorry. It's this, I catch it and I go like right away and I go like to the acronym. Anyways, if you're joining us for the first time, welcome to a Hi Mama webinar. If this is your second, third, 50th, well, we're not that far along, but if you're joining us again, super excited to have you here. But as always, disclaimer, just important little piece here. I am not the face of legal advice. I'm not, sadly, financial advice either. You don't want financial advice from me. And at the end of the day here, we want you guys to take away tips, tricks, strategies. And if you're ever looking for any help, licensing rules or regulations, make sure to just pop on there and find the right person that you need to talk to, whether they be a financial advisor, whether it be a licensing representative, whoever it may be. a lawyer, even wherever you're looking, just make sure to find the right people for the right things. Sadly, that's not me. I did not do enough school for that. Housekeeping. What you can expect from us today. So as always, okay, folks, don't fret if you have to pop off for whatever reason. Everything is recorded. It's going to be available for you, show notes and the slides. So everything you see here today will be available to you. We send out the show notes tomorrow. So don't fret if, like I said, if you have to scooch out halfway through or you only make it in halfway through, whatever, okay? Certificates. Not only will they be made available at the end of the webinar, but they also will be made available through the show notes. Okay, so not to fret there. You'll have lots of options to get those out there. Any resources we talk about today, everything we'll try to include as much, if not all of it, in the show notes. Obviously, try to make sure every resource is out there for you. And connection-wise, if you're finding your connection is just not bang on or that it's not great, hit refresh us, reconnect to the session. I promise you're not going to miss out. And especially if you do have to pop off, we'll make sure to get you guys recorded. Okay. Myself, if you're just joining us, I'm Maria Simon. I am an RACE specialist here at Hi Mama. And if you've been following along with us, I got married almost a month ago. It'll be a month on Monday. I had to think about it really hard, guys. But fun fact for me, that's a new end of sailing season for us, guys. It's kind of sad, actually. We had to take our boat out of the water today. For anybody who lives in a northern country that gets tons of snow, you can't leave it in the water all year round. So that's our big thing right now. That will be the weekend project, is closing that up and making sure we're ready to go. Carmen's on chat. Carmen, come on here.
Hi, everyone.
For you, anything new? Fun fact?
Nothing new. I'm still in Montreal. It's actually sunny for us here, so I'm really enjoying the weather today.
Oh, good. I wish. This is coming your way, I'm sure. As always, everybody, say hi to Carmen. She's on chat. Also, thank you, Brenda. Make sure any questions, she's grabbing them, guys. So make sure to point them in her direction there. And then I'd kind of given away, Andy's coming with us. We're going to bring him on in a little bit, but we had Andy on many episodes back, okay? And I want to say at the very beginning almost, and I didn't look back, and I do apologize. But at this point, Andy is fantastic. He's got so much background behind him, which is why it's so interesting to talk to him and why it's so cool to hear like his opinion about what's happening right now. And we're going to be talking about, of course, cold and flu season is here and it is upon us, and how the impacts of COVID and being prepared at your center. And we also want to touch base a little bit. It's October Fire Prevention Month is a huge piece right now. And then just kind of looking into 2021 and thoughts around there. So kind of alluded to a couple of things we're already in chat about with Andy. A couple of things we're going to talk about, just a little bit about that flu season, topping up your sick policy. If you haven't already had one in place, you should get on that, folks. Just make sure. Being conscious of your team, just kind of a little small recap from what we chatted back last week with Corey, the ifs, and then let's dive in with Andy. So I don't want to keep us waiting, because at the end of the day, I'd like to spend more time chatting with Andy than anything else. But of course, that dreaded achoo. Every child does it. And even my husband in the middle of the night last night is doing it. And at the end of the day, guys, we're doing a little bit of homework here. And if you should pop onto the CDC website, kind of really hard to determine right now the differences between the flu, between COVID-19. We know so much about the flu, but we know very little about COVID-19, and we're still working towards that. At the end of the day, the biggest difference is that I took away from me, and of course, maybe, the runny nose one right now is just so up in the air. It can be, nobody knows really at that point. But the biggest thing was loss of taste and smell, and apparently it's much more contagious than the flu is. So I'm like, oh, you learn something new every day, folks. But this, of course, like I said, all content here on the site, I was just taking away from CDC and making sure to have their dots, their I's, and everything like that. At the end of the day, like I'd mentioned, if you have not had a sick policy in place, this has been a huge gray area actually for a lot of centers. And as well, it has been something that, it had gray spots around it, or you might have had bits of it. Get that sick policy, make sure it's up to date, and remember that there's no exceptions this year, folks. There's no exceptions to children, teachers, parents. It's better to be safe than be sorry. And as flu season is on the doorstep, if not already here at this point, make sure to get out some good reminders, not just reminders about what to do during flu season or do with COVID right now, but as well to remind your families about your policies. I think that's one that kind of gets lost in the weeds. At the end of the day, you want to make sure that you're covering everything in regards to enforcing sick policy. And of course, that changes from, I want to say, health unit to health unit. Prior to this, we would have had, 24 hours for fever. In some areas, I know some areas are a little different. Sometimes it's 48. But other areas, it would be, sometimes it's 48 hours, sometimes it's 72 hours. So it just depends on what your area is obviously licensing you for. Continue your hard work, folks. You guys are doing some great things. And at the end of the day, I'm kind of wondering, in the back of my mind, I'm thinking, if we're doing all this extra cleaning and if we're doing all this extra work, does it actually mean we might see less of the flu? I don't know. I don't know. But keep in close contact with your health unit. Big piece here is if you have a better idea of what's going on in your community, and if there's, let's say, an outbreak of the flu, then maybe you would see more cases within your center. Just keeping that connection open with your local health unit, you'll have a better idea of what's going on. And of course, as well, you're in contact with them right now about COVID and what's happening with COVID. And so ideally, you're just going to strengthen that connection about what's going on. And maybe for years to come too. That might be a great place to really keep that communication going at the end of the day. Flu shots, folks. This one we're going to talk about with Andy. At the end of the day, obviously, for those who are super vulnerable, I personally recommend you get your flu shot. I'm also the one who maybe be the last one in the door to get the flu shot, to be really honest. But make sure that your people are safe too. Whether they be young, whether they be old, whoever it is, if you're at some sort of vulnerability, guys, I can't speak today. Make sure that, you're just doing your own due diligence there. So promote some mental health. We talked a ton about this, a ton about this with Corey last week. If you didn't have a chance to be here for that one, I highly recommend you watch the recap video. It's fantastic. Corey is amazing. And so just making sure you're being aware about, how your teachers are feeling, how you're feeling. Like, that's super important. Making sure that you have as much mental awareness about how you're mentally doing and how you're physically doing. They go hand in hand, folks. So if you need to take that day, don't be shy. Personally, having a mental health day is super, super important. I cannot stress being on top of it right now. We were talking about this even prior to the webinar about, people are working so much more because you're at home potentially. Deborah, you got your flu shot yesterday, I see. Good for you. My mom and my dad have also gotten theirs. They're pretty on top of that. They're also in a bit of a more vulnerable category, just with age and, health and everything like that. So I just recommend. So the ifs, the what ifs, everybody. And I think we need to turn it more into the when now. I hate to say that, guys, but you can't plan for everything. I don't think you can plan down to like every single teensy-weensy tiny detail, but I think you can at least have a plan in place. Whether that's you plan for a future lockdown. I think here in Ontario, we potentially could be going towards that now. Whether you plan for a partial lockdown or closure for 2 weeks or so, or whatever it is, think about your ifs and your whens. Put them into perspective of like, okay, so we do close down. Are we going to, let's say, fully return virtually? Are we going to open for essential service workers? What is it, maybe your thoughts moving forward? And have your team help you with that plan, just so you have an idea in place. And then this way too, you don't feel unprepared when the craziness does come out. And like I said, of course, you can't plan for every teeny tiny detail. Things are going to go far away, but you want to make sure that you've got something in your place to just roll out. It's better than absolutely zero. With, I say, plan in place and being prepared, I want to bring Andy on. I'm super excited to have Andy. This is where I spend all the time. He's here.
Hey, everybody.
He's back. I'm sure you're gonna get lots of love. But Andy, before we dive into like all the fun, all the questions, just for our folks who potentially weren't here with us last time, maybe just give us a little bit more about you and the Institute of Childhood Preparedness and kind of what you guys do.
Sure. Well, it's great to be back, and so many wonderful folks in the chat. Hello, all friends. I've seen Illinois, New York, West Virginia, New Jersey. I've seen everybody. Yeah, it's fantastic. Even Tulsa, Oklahoma, which is funny because I was cleaning off my desk and I found matches from Burn Company. So you get to Tulsa, boy, some of the best barbecue I've ever had. Andy Roszak here. I started off as a firefighter paramedic in the Chicagoland region. I'm from Illinois originally. I spent about 10 years as a firefighter, and then I went to law school. So there's probably a joke about, I don't know, chasing the back of an ambulance or something. But all my work essentially has been in emergency preparedness and public health. So I worked for the Illinois Department of Public Health for a while doing some health policy. After law school, I got a job at the United States Senate working on healthcare reform and public health policy. When healthcare reform in the United States passed, I became a senior public health advisor at the U.S. Department of Health and Human Services during the H1N1 pandemic. And was the senior preparedness advisor for Super Bowl 46 when it was in Indianapolis. And then came back to Washington, D.C. as the senior director of pandemic preparedness at an organization that works with the 3,100 local health departments in the United States and with the CDC. So I've really been doing pandemic work for, the good part of about 10 years now. For the last 6 years of my life, I've actually been working specifically in early childhood. So the Institute was founded to help early child care providers and professionals prepare for, respond to, and recover from emergencies and disasters. And I'm really happy to be here with you today. I also serve as the chief of health and safety for the Region 2 Head Start Association, which serves New York, New Jersey, our good friends down in Puerto Rico, and of course the U.S. Virgin Islands. So very excited to see so many of you from the Northeast on the webinar today as well. But really excited to be here with you as always and dive into all these really important and hot topics that we have before us right now.
So many hot topics. So many questions have already come through. Like, I'm super excited to start throwing these at you. But let's start with where we left off last time. We were chatting about second wave. Of course, that was the if second wave, when second wave was like that borderline. We weren't quite sure where it was going to hang out. Maybe what's on your thoughts with second wave and playing out this fall?
Well, so the second wave has always been kind of the big thing that we're worried about. And the reason we're really worried about it is we don't have a lot in history to compare this to, but one of the big things is the 1918 pandemic flu that killed anywhere from 50 to 100 million people across the world. So it was a big event. And what we saw in that 1918 pandemic was it wasn't really that first wave, wasn't really the third wave. It was that second wave, which coincided with the winter and our flu season, that really killed the bulk of people. So, from a public health standpoint, everybody's always been really concerned about what is this virus going to do in the fall and in the winter. And there's really two reasons for that. First off is because we know that hospitals already are going to be increased with the patients coming in because of the flu. And then the second big reason is because we know that this virus, much like any other communicable disease, it has a tendency to transmit much more easily when we're all inside breathing the same air and being close to each other. So those are kind of our two considerations that we have with the second wave. And a little fun trivia fact, looking back at 1918, the reason why radiator heat was invented in New York City was because of the pandemic. And they wanted a way to heat your home, but still allow you to be able to open your window so you get that fresh air coming into your home or your apartment or your condo. So all the way back to 1918 and the advent of radiator heat was to address some of these issues that we're now facing, 100 plus years later.
That's crazy. Andy, I just love how you have all these fun facts too. You just pull them out of your pocket like the best time. I love it. That's really cool. I'm going to take it away. Talking about being prepared then, and of course, with centers right now, I know when we had you on last, we talked a lot about ventilation and opening up and being outside. And of course, now we're having to go back inside, especially in those areas that do get colder. I think we might see some migration to warmer climates. But at the same side, do you think centers should be preparing for a difficult flu season because of second wave? Do you think it's going to be a huge impact?
Well, there's a couple of things that we got going in our favor, and I don't think they were fully appreciated when we talked, 6-7 months ago. One of the big drivers that we have of any flu season is the amount of global travel that takes place each year. And it sounds kind of weird, but if you think about 1918, we were just ending a world war at that point. And there was a lot of movement of soldiers around the world as they came back home after the war was over and whatnot. And that really caused a lot of this virus to spread back in 1918.
Yep.
Well, think about now in 2020, gosh, we're not traveling very much. And, we're doing a lot of things. We're not traveling, but we're washing our hands a lot more. We're maintaining social distancing. We're not going to large gatherings. So that's all in our favor. The other thing, which is kind of a sign of good news for us, is looking at places that have already had their flu season. And in particular, looking at, Australia and the places down under. And to be honest, their flu season wasn't all that bad. So I'm really kind of optimistic that hopefully this flu season isn't that bad, because it's going to be very hard. In fact, it's difficult. It's impossible. Even as a board certified physician, it's impossible to tell the difference between the normal flu and coronavirus. You can't do it without testing. So, the signs and symptoms are almost identical. You're going to have to treat anybody as though they have coronavirus, because you're not going to be able to tell without a diagnostic test whether or not this is the flu, whether or not this is allergies, whether or not this is coronavirus. And that's a pretty difficult spot for our healthcare infrastructure to be in, quite honestly.
Totally. Very much so. I know here in Ontario, we've definitely, of course, recently, especially over the last 2 weeks, seen a huge uptick in cases and more cases within the hospital. And now with the flu season being upon us, and as we enter it, we're, of course, they're getting a little nervous about how many people are going in and how many beds we're going to have. And that's, of course, been the big prepared part on our end. But leaning back, do you think, I know when we talked about this last time about having a pandemic policy within a center, do you think that center should be looking to make any changes to that with that second wave, and with the fact that they are anticipating many more cases, as well as it being just really hard hit in some areas too?
Yeah, I definitely think if you haven't looked at your pandemic policy, you definitely should. As you mentioned early on in the webinar, and certainly something that I preach every day, the more you do the more things you can do in advance, the better you're going to be. We just put out a new course on crisis communications, because what we were finding is that people weren't taking the time to think about, okay, if a case comes, or when a case comes, what am I going to say? What are the messages I want to get out? How am I going to communicate this? And my phone was ringing off the hook, because programs across the country saying, oh my God, it happened. We have our first case. What do I do? Can you read this email? What should I say? This and that. And the time for you to put that communication, that email, that correspondence together is not when you're in the middle of this emergency or disaster, because it's going to be driven by emotion.
Totally.
Right. And, I am a lawyer. I'm not giving you legal advice. I'm a lawyer, but I'm not your lawyer.
He's not working today, guys.
I'm not working today. But, basically as an attorney, I get worried about, in the heat of the moment when emotion is high, what are you going to put in writing that's now going to be out there forever? And somebody can print it out and bring it into court or whatever have you, and try to hold your feet to the fire. So much like I would say with, today's the great shakeout. We're doing earthquake drills all across the country as well. Earthquakes, tornadoes, fires, floods, hurricanes, whatever have you, the more of this stuff you can get in place, the better it's going to be. And that's really why we put this new course out there. And we actually walk you through the essential elements of a crisis communication, what that should look like. And we even gave you some examples of what was pretty good and then what was not so good and you should stay away from. But as with everything, preparedness is key. I think you were also really on point when you said it may not be a matter of if, but a matter of when. Yep. Let's face it, every year kids are sniffling, kids are sneezing, kids have runny noses. That's what kids do. They're incubators for germs. That's how they build up their immune system. True. Yep. So you'd be foolish to think, if you're not going to have a kid that comes to your program and has a fever or has a runny nose or is coughing and sneezing, that's going to happen. And, the more we can do to think about that ahead of time, to write our policies, and then importantly, educate our staff and our parents about the policies, is going to be key. Because you don't want to get into an, I don't know if argument is the right word, that might be too strong. You don't want to get into a conversation with a parent who's trying to drop off a kid with a fever, a kid with a runny nose, all that kind of stuff. You'd want to make sure you communicate that in advance so everyone understands the expectations. That's going to really help diffuse the situation.
I totally agree. It kind of falls along the lines of, you may have to tweak it in the end, but having something there to start you, and in kind of being a void of that emotion when you do have to, let's say, send that letter out to that family, or to, tell that teacher that they can't come back. You've got something in place for yourself where your I's are dotted, your T's are crossed, but at the same side as well, you can, after that, insert emotion and make sure that, you're caring for that family at the same time.
Absolutely. And we have certain messages that we want to get out, right? And we don't we want to make sure that those are carried through all the conversations, regardless of what there's emotion or not. But, every opportunity that you communicate should be an opportunity for you to reinforce the safety protocols that you're taking, how health and safety of your staff, and of course the children and their families are of the utmost importance. Those themes need to continue in every communication and really every action that we do. So that our parents really understand that, hey, we're doing all we can do in this unprecedented time. Totally.
I totally agree. So with that, do you think centers who might be in a position where they've had exposure, they had a case, do you have any advice for them about moving forward, or even potentially having other people tested within the center? Just any advice around it right now as we do jump into more cases just around the world too. So.
Yeah, and I will just say, Rhea, in a perfect world, we would have ready access to quickly available tests and quickly available results. Right. And there's wide variation. I mean, we've got folks on here all over the United States, certainly all over Canada. What you're going to have in your neck of the woods is going to be a lot different. Now in Washington, D.C., my wife and I, we went to right by it used to be called the Verizon Center, where the Washington Capitals play hockey. They have the entire street closed. We were able to go in there at 8 o'clock in the morning, stood in line for about 10 minutes. We got a coronavirus test and we got our flu shot in under a half hour. And within 2 days, we had the results back. Now, that's very different than a lot of places. Right?
Sadly, yeah.
Sadly.
Very true.
And I hope, and by the way, it didn't cost us a dime. It was all free. Mm-hmm. So shout out to jurisdictions like Washington, D.C. that are doing really good things. There is some new tests that are going to be coming out. Mm-hmm. There's some right now. I was just looking at some out of India and out of Israel that are essentially an at-home test kit where it goes with saliva. And I think, if we can get some of those to market and get those out there, that's going to make our testing a heck of a lot easier. So in an ideal world, would I want everyone to get a test? Yes, but I think there's limitations that we have to just recall, that a test is merely a snapshot in time. So if I take a test today, but then, go to a funeral, a wedding, a bar mitzvah or something tomorrow with 100 people, the test results aren't necessarily going to be reflective of my current state. And by the way, you can get coronavirus and you can have it for 5, 10, maybe even 14 days. And it's incubating in your body. And during that incubation period, it may not even show up on these tests. So a lot of uncertainty about, the testing and the reliability and the accuracy of tests.
It's very true. Actually, we were speaking several episodes back. We had Dr. Dina on, and we were talking about, of course, specific children in this case, because she's a pediatrician, but she was saying about how, especially in children, it can be, it's like a 50-50 chance sometimes with the test. And so having a more powerful test and a more standardized test across the area would be fantastic. Will that happen anytime soon? Probably not, but we can be hopeful. we can hope. Be hopeful.
And, that's one of the real challenging things about this particular virus is that, half the people that get it aren't showing any signs or symptoms.
Yeah.
So, essentially we have in public health what we would call a silent spreader. That is, walking around. They don't know they have it. They don't feel sick. They don't, know anything's amiss, and they could potentially be spreading it. And again, just to reemphasize, I know we talked about this last time, but this is spread primarily through droplets coming out of our mouth that contain coronavirus. So anytime we're talking, anytime we're breathing, anytime we're singing or coughing, any of that stuff is transmitting the virus potentially. That's why you're seeing such a push for social distancing and such a push to wear the face masks to try to keep those droplets from, really getting into the air and being spread for a long way.
I agree. Yeah, let's do our best there. But I want to change gears a little bit, because you had mentioned this. You got your flu shot. So of course here in Ontario, a huge push for everyone, especially those people who are most vulnerable, at high risk populations, parents, teachers, all those great people who are out there involved in working with many people are really encouraged to get the flu shot, and just the general public. Do you think, or do you recommend strongly getting the flu shot? Do you think it will help potentially protect against it at all? What's your thoughts on it, Andy? This has been a huge one as well through the chat. So,
well, absolutely. I mean, I think every year is a good idea to get a flu shot, but this year in particular, it's a very good year. And I will say, depending on your health state and your age and all that kind of stuff, there's different flu shots for different people. Right. So if you are up in age a little bit, you're going to get a different flu shot than if you're a very young person. If you're pregnant, you're going to get a flu shot that's different than the rest of us. So, not all flu shots are created equal. So I would encourage you to have that conversation with, a medical provider.
Of course.
But certainly, and the nice thing now about the time is, generally this is the time of year when we want people to start getting the flu shot. People that get it back in, June or July or early August, in some cases we'd say, hey, that's a little bit too soon because the flu strains aren't really circulating too much then. But we're just now coming, because flu shots wear off after a while. That's why you have to get it, right? So we're just now in October, the middle to the end, we're in a really good spot. So if you haven't gotten your flu shot now, I'd really encourage you. Many local health agencies throughout the United States, and I'm sure in Canada as well, are offering, flu shot clinics where they are either free or very low cost. I know all the chain pharmacies in the United States are offering flu shots that you can walk into and usually get it within, 5 to 10 minutes. So something good to protect yourself and protect those around you. And again, the big reason we're doing this is because you can't tell the difference between the flu and the coronavirus. We don't want hospitals getting overwhelmed with people with flu instead of coronavirus. And also we want to just make sure that people are healthy. So yeah, definitely encourage you to get your flu shot. For the young ones, you'd have to check with your pediatrician. Again, it's going to depend on age and weight, what kind of flu shot they need. But certainly everybody in every age group should be thinking about getting the flu shot this year.
I definitely recommend. I'm not a huge fan of needles, is to say the least, but I'm one of those, Andy. I run the other way. My husband has to hold me down. He's like, it's okay. And we were, of course, having that very serious conversation of do I need to hold you down this year? Or are you going to walk in? What are you actually going to do? And I'm like, well, I'll walk and you can push. But I strongly recommend at the same time. So we're talking about fall. We're talking about, like we'd said 6 months ago, we thought maybe we'd be in a better place now. And of course, we were in a pretty strong place. And now, of course, we're kind of going up and down with questions of second wave, how it's doing, cases going up, cases going down. It's just kind of an area that's so gray. What's your outlook on 2021 right now and the childcare, leaders in the area and their long-term plans? Is there any maybe sort of advice you want to give them as we say 6 months from now, where we think we might be? Because of course, 6 months ago, we didn't think we'd probably be still working from home, but.
Well, we said early on that I wanted you to prepare for the long haul, and this was going to be a long-term event. And, I think I continue to be amazed at some people that say, oh, we're just going to get back to normal. Well, this has changed. This has changed the way that we live. This has certainly had an impact on society, certainly had an impact on our mental health. And like any other major event, whether it be September 11th, for those of us that, are involved in and around that, Hurricane Katrina, some of the wildfires, this event is going to be sentinel. It's going to change the way that we do business. Can you ever think now going forward of a time where you would have a birthday party and put a bunch of candles and have somebody come and blow and spit all over that cake and then serve that cake? I just don't think I think we're a little bit more public health conscious now. And that's a good thing, I think, for some of this stuff. It's probably going to get bad in some places. What we saw in places that got really warm this summer, like in Florida or Texas or Southern California, is we saw that spike when it got really warm. And the reason we saw that spike is because people came inside to get into the air conditioning. And again, once we get inside and start breathing that recirculated air, that's when trouble can occur. When we build hospitals, we don't ever recirculate air. So hospitals take air from the outside, they heat it or they cool it. They put it through the building and then they exhaust it out. You don't get this recirculated air. We don't do that in our homes. We don't do that in our businesses. It's very expensive to do that.
Yep.
So, again, having that ventilation is going to be important. But certainly you're going to see more cases. It is going to be community driven. So I would encourage you to find out. Pretty much every county health department in the country, if not the county, at least the state, is publishing at regular intervals, how many flu cases or how many coronavirus cases there are, what the positivity rate is, how many new ones are coming, based on testing. And a lot of this stuff is going to be decided based on these local rates. If you have a neighborhood or a community that the rates are skyrocketing, it's going to be unsafe. If you have a neighborhood or community that the case count is really, really low, and think about southern Indiana, southern Illinois, places where there's just not a lot of people, things are going to be relatively safe. So I think we do have, everything is going to be a local decision. That's why I think it's really important to connect with your local resources. But we will get through this. And I would say, if we get the vaccines, and there's a couple really good candidates right now, I would say by, June or July of next year, we can start beginning to put coronavirus behind us. But I definitely think it's going to be here, throughout this year, of course, and maybe even throughout next year. It's going to be around for a while, just to be honest with everybody.
I agree. I won't lie. I came into it optimistic in March thinking, I was kind of just going with what the leaders were saying and that we'd be back by July and those sorts of things. And life was going grand. And then reality hit and I went, well, no, I'm going to be at home for a long time. And I think that's the reality for a lot of people. And of course, it's also scary too for many people who are in, some very drastic situations right now, and their home life may not be their best life as well. So,
I mean, it's very scary, and there's and there is no doubt consequences. I mean, the food lines, people are suffering, people are out of work, reduced hours, reduced wages, reduced access to food. And what's really, and I see we have quite a few Head Start colleagues on the line. The communities that Head Start serves, and for those in Canada, Head Start is a federally funded program.
Hugely important. Yeah.
It's very important, but it has income qualifications. So, if you're the child of a millionaire, you're not going to Head Start. Head Start is serving in many cases, most vulnerable communities that before this pandemic were already struggling on a day-to-day basis. And certainly with, a lot of folks that are hourly workers or rely on food industry or entertainment industry to make a living, they've really been suffering. And I think a lot about our Head Start families, it's not uncommon to have parents that are working, 1, 2, 3 part-time jobs to try to make ends meet. So I do hope there's been some movement in the last, 48 hours here in the States with our Congress. $1.8 trillion relief package, package number 2 or 3, I guess. I really hope our elected officials can get some help out to those that really need it during this time.
I totally agree. For us here in Canada, we're looking at like some sort of universal childcare. Of course, it's just in a messy area right now, but I think it's also could lead to some really positive outcomes in the future for every educator. Obviously, in this case, it would apply to Canada, but I think across the states, just being able to have that money and have some sort of way to get out to those families and those teachers too who need all that support. So
I just saw an interesting comment in the chat box. It says, does the flu shot provide 100% protection? No, the answer is no. And the sad thing is we're not going to know how effective this year's flu vaccine is until next year. So if you look back at history, flu vaccines are very different each year because essentially, remember, the normal vaccine process takes about 18 months. So that means the flu vaccine that we have for this particular season, they started working on 18 months ago. And what they do essentially is they make, and I'm going to say it's a guess, but we all understand there's science. It's more than just a guess, right? Yeah. But essentially what they're trying to do is look into a magic ball and predict what will be the most relevant, what will be the most common circulating flu strains in 2020. And they try to match the vaccine with those strains so it's most effective. But on a normal year, you can go from anywhere from 19% effective all the way up to 60% effective for our flu vaccines. So we really hope this is a good match to the circulating strains. We hope that vaccine is going to be 50 to 60% effective. But no, it will not be 100% effective. And it never will be because it is kind of a guessing game as to what strains are going to be circulating in any particular year 18 months in advance.
Andy, I'm so glad you grabbed that one. That was on point, and it's so true. It's they have it out there, and they're trying to make sure that they can cover us. I'll be interested to see what next year's flu vaccine will be like after all of this. So.
Well, after H1N1, we started putting H1N1 vaccine in with the normal seasonal influenza vaccine. Mm-hmm. I really wouldn't be surprised if a couple of years from now you see, because the coronavirus isn't going to go away. It's still going to be circulating. It's just that we'll have some immunity to it. So it's very likely that in future years, part of your seasonal flu shot may contain a coronavirus vaccine embedded in the flu shot, quite honestly.
I totally agree. I think it's going to be a very interesting combo. And of course, after I think we have a little bit more time and research behind the COVID-19 vaccine, we'll definitely see like a lot more. Obviously, hopefully we can get rid of it or do whatever it is that it needs to do, get it under bay. I'm sure we'll see different strands of it coming in the future too. So I want to give a moment before we jump into Q&A, because there's some really good questions coming through, but it's Fire Prevention Month. Maybe just touching base on that one. It's important. I just had all of our fire alarms checked in our condo here, and it was driving me crazy going off when it shouldn't be. But anyways, it was time. Touch base on that first, Andy, and then we'll jump in with your courses and your books and go into Q&A, because I want to make sure to give you a little bit of time to chat about those. So. Sure,
absolutely. And I appreciate, it looks like our colleagues from South Africa are saying they're having a hard time struggling. I know I saw some folks in the chat from London on earlier. I know London, north of London, looks like they might go on lockdown. France looks like they might go on lockdown again. So, of course, our thoughts and prayers are with everybody. And we're all in this together. This really is a global pandemic. And hopefully things that you're learning or things that we're learning can help each other. But it truly is something that is uniting all of humanity. But you're 100% right. October is Fire Safety Month. And amazingly, every year in the United States, we have 560 fires at early childhood locations. I mean, it's over a fire a day. It's just nuts. Yeah, who would thought, right? Wow. So, I want folks to be prepared. I want folks to take this seriously. I was a firefighter for 10 years, and I've seen a lot of things that were really preventable, things that led to a lot of bad outcomes and people hurting and dying and suffering unnecessarily. So please, let's not forget our other responsibilities in the middle of all this coronavirus stuff. The big fire code violations that I would see all day long, extension cords, especially as we're starting to get cold and people are plugging in heaters and those types of things. Yep. Extension cords are not meant to be used as a permanent solution. They're really meant to be temporary. They're definitely not meant to help you extend the reach of any kind of a heater. Those cords, those wires, and then extension cord, they're just not made strong enough. They don't have the times of the wiring necessary to hold the kind of current that a heater needs. So please never plug in a heating device, a portable heater into an extension cord. Please don't put the extension cords under rugs or under, carpeting or anything like that. What happens is people will step on them. Again, the wires will get, broken or frayed or damaged, and then that'll create essentially a short in the wiring and cause a fire. Fire safety is important too. When we think about cooking, we want to make sure that if we're cooking and kids are around, take your handles on your pots and pans, put the handles towards the back so that kids can't reach up and grab handles. I'll never forget this call I got. It was Thanksgiving. It was 2001. A little tiny 4-year-old reached up and pulled a pot of boiling water off the stove.
Oh, no.
It was one of the most horrific things I've ever seen. 3rd-degree burns all over this poor child's body. Oh. And, again, just totally preventable. So let's learn from the mistakes of others and just try to be safe. I know it's really easy now to get distracted, whether you're in a childcare setting or you're just working from home and you're got kids running all over the place. But taking some time to make sure we're keeping things up to date. Make sure your smoke alarms are good. Test those batteries. Carbon monoxide is something that we see kill after every major disaster as people run generators and carbon monoxide kills them. It is a silent killer, so you'll never even know that it's until it's too late. So very, very important stuff. Hopefully, I was working on it before our webinar today. My goal is to get a fire safety and prevention course online and out before the end of this month. We'll talk about all these things, how to make your plans, how to do drills, what they look for when they do fire inspections, So that'll be up in line. That's my promise to you. I'll get it done before the end of the month. So it's about halfway done now. It's coming together really good.
We'll hold you to it, Andy. Tell us about your some of your courses as well too. We have a promo code for you today to go with us. But tell us a little bit. I'm just going to pop off here so you can see the full show. But tell us, Andy, a little bit more about some of your courses you're offering.
Well, we got a whole bunch of courses. We started putting our coronavirus courses online in February, if you can believe that. And it was really our goal to get information out to the early childhood community and just try to cut through some of the noise. So we've spent a lot of time, a lot of experts, folks with advanced degrees, doctorates, and et cetera, and all this stuff, infectious disease. But we got a whole bunch of courses here, as you can see, everything from cleaning, sanitizing, disinfecting, which is going to become even more important as we move inside. A new study came out of Australia about 48 hours ago that says that coronavirus can live on your skin for up to 9 hours. Live on your skin for up to 9 hours. So we got to make sure that we're cleaning, that we're disinfecting in the proper ways. Of course, we got to make sure we're washing our hands. We've also got a lot of questions about food safety. So we put together a special food safety course that looks at coronavirus. The crisis communications I talked about earlier, behavioral and mental health, huge issue. We've got 3 mental health experts that join us on that. We also talk about children with developmental disabilities and how coronavirus is impacting and interrupting, their life and their learning in that course. And then we've got Dr. L.J. Samuel, who's an expert in domestic violence. She's a veteran of the Washington, D.C. Metropolitan Police Department and has seen these issues firsthand. So she talks about the uptick in domestic violence, what we can do about it, some of the warning signs, but all very important courses. So a whole bunch of stuff on coronavirus. Use that code HiMama10, 10% off anything. We're just pricing these so that people can buy them. The coronavirus courses are very, very cheap. They start at $19. So we know that people are hurting for money. We're just trying to get the information out there and cover our costs for production and hosting all these courses.
That's fantastic. Tell us a little bit, Andy, a little bit about your book. I know when we were chatting via email, I got really interested about your book and about how just reading a little bit about it. I may have to order one myself, but go into detail, Andy.
Well, we're very excited. So our first book, Preschool Preparedness for an Active Shooter, is out. That came out over the summer. You can get this on Amazon, Barnes & Nobles, anywhere books are sold. The second book, Preschool Preparedness for an Emergency, has just came out for pre-order. So Active Shooter is going to talk about all sorts of acts of violence. Sadly, as you know, we're seeing a big uptick in violence. We're seeing a big uptick in gun sales. If you think about it, it's almost unbelievable. But March of 2020 was the first March in over 10 years that we did not have a school shooting in the United States. And, school wasn't in session, so they didn't have the opportunity. But what really troubles me is that if you look back historically, after every break, whether it be, spring break, winter break, summer break, after every break in a school or in an education setting, once we start coming back, we always have an uptick in violence. We also always have a school shooting. And I'm just really worried with so many people on edge, and so many people have been on edge for so long, that when we do start reopening up, we're gonna have a lot of trouble. So again, coronavirus is obviously at the forefront, but let's not forget how to keep our program safe and secure. And the good news is with coronavirus, we have the opportunity to really enhance our safety and security, and we have the perfect excuse. We just say, look, you can't come in. We don't have visitors now because of coronavirus. And you lock your doors and you limit the access to your building. Something we should have been doing for a long time, but now we have that perfect excuse to really implement that policy. The second book, Preschool Preparedness for an Emergency, you can pre-order that now. That talks about everything in terms of disasters and emergency, how to make your plan, what your plan should include. There's templates, there's guides, there's all sorts of good stuff in there. So if you haven't picked up a book yet, boy, I'd be appreciative. You can get them on Amazon or, again, anywhere books are sold. But they're there for you. I wrote them for you guys. They're specifically for early childhood.
Andy, this is super exciting. I love it. There's so much going on in the chat. I don't know if you've been watching it at all, but as well being respectful of people's time, I want to jump in. There's been 2 questions specifically that have been at top of everybody's mind. So the first one I want to ask is, how long between flu shots? I saw this from several people, and I know Carmen's been pinging me. How long between flu shots would you recommend for, let's say, children and adults? I don't know if they can be different. I know because you said they are different types, but yeah.
So, I mean, the flu shot's good for the season. So if you get the flu shot in October, that's going to carry you through till, January, February, March. So you're only talking about one shot. Now, some of the folks, if you have immunocompromised or if you're a real young child, sometimes there's different variations of the flu shot. So you may have to get 2 shots. But that's really a conversation to have with, your pediatrician or your medical provider. Same thing we do, with pregnant women. There's a difference between kind of a live, what we call a live flu shot, and one that's got more of a passive or a dead flu shot. So, if you're immunocompromised or pregnant or any of those kind of conditions, have that talk with your providers. But no, you just need to get it in October or, around here, and that'll carry you through for the flu season. So just one jab. I know for folks that are afraid of needles, that's enough.
It's plenty. It's plenty. Excellent. Next one I've seen as well has been, they're more twofold. So one of them is about what's your thought on air purifiers? I've seen this from several people. And did you have any recommendations about potentially centers getting air purifiers, and even maybe a type or two, if you know one off the top of your head, if they do have poor ventilation?
Yeah. And this is something, and if I could swivel this camera around, you could see I practice what I preach. I've got a HEPA air filter sitting right in front of me here. So
in the office, it's in my office.
But hey, HEPA air filters have been, they're fantastic, and they're good. We should be doing this for years. Again, one of these things that I'm glad we're finally talking about. They reduce, pollen, they reduce dander, they help out with asthma and all sorts of breathing things. And they're really good, just to purify your indoor air. Now, the nice thing is most of the science about the coronavirus, it's a very small little tiny particle. It's about 0.2 microns. So it's very, very tiny. HEPA filters will capture particles that are that size. So in theory, if you have bad air circulation, you can't open windows or whatever have you, whatever your specific case is, it certainly cannot hurt to get a HEPA air purifier, because in theory, that should be able to trap the coronavirus in the HEPA filter itself. Now, the caution is, when you go to change out your filter, I want to make sure that you're wearing gloves. I want to make sure that you're wearing your mask. Even if you can unplug that thing and take it outside and start changing the filter, that's even a better idea. But certainly, just like when we're spraying, our bleach solution for disinfecting and all that kind of stuff, we don't want to be doing all this stuff when the kids are around. So if you're changing your HEPA filter, if you're spraying the disinfectant solution, let's do that after hours or early in the morning when nobody else is around. Let's make sure that we, go outside and get some good ventilation. And also, let's make sure we're wearing your mask. And I got to say, it was so funny. I was in a store yesterday, and look, we don't expect you to be healthcare providers. I mean, I'm a paramedic. I got trained in this stuff. I'm a hazmat technician. I wear the full body suit and I go handle bad chemicals. I've been trained professionally. These things are really good. These are medical masks. You can get them. They're also called surgical masks. But you notice they're blue on one side, they're white on another.
Yep.
The white side goes towards your face. Okay. I saw somebody wearing it wrong yesterday, and I didn't want to call them out because I appreciate what they're doing, but I did pull them aside and say, hey, just so you know, you got it on backwards. The other thing, if you look at the stitching on this, the white stitching at the top and the bottom is different. So the stitching on the top here where it's white, it's a much thicker stitch. And that's actually the part that you want to put up here by your nose. And once you get it on, you want to take that, and there's it's almost like one of those things that holds cords together, like one of those little twisty ties.
Yeah, it's almost like a twist tie, but maybe not as flimsy, a little stronger than that. Yeah.
So you want to mold that to your nose so you get a good fit. So, just a couple real basic things, but the blue side goes out, the top with the big stitching goes up, and then you want to put that on and mold that to your nose. And yes, it does go over your nose because, again, we're worried about breathing out the droplets. So just a couple of things I just wanted to bring up, because I did see it yesterday, and I didn't want to cause a scene because I appreciated the person wearing the mask to begin with, but I also wanted to make sure they were doing it the right way.
I agree. Andy, it's always a pleasure chatting with you. I've been looking forward to this webinar since Carmen said, let's bring Andy on. I was like, I want to bring Andy back on. And I've been so looking forward to it. I feel like bringing you on, you always great insights, as well as like a little bit of that happy thoughts. At the end of the day, we've had a couple really nice happy moments. A lot of people in the chat have been saying this has been fantastic. And at the end of the day, we want them just have some of those great takeaways. Any words of wisdom, advice you want to leave us with today, or even, share your happy story. Even there. Oh yeah, you thought I forgot, eh?
Well, I'm very excited to announce, finally, my wife and I are expecting our first child in January. So we're very excited about that. And we're looking forward to 2021 being a lot better year than 2020. But I would just, and we're all part of this community. And, really, if anything, I think this has shown how interconnected we all are. How there's a great community that comes together, during times of crisis and emergency. This is very unique because most of the time I saw somebody in the chat from Joplin, Missouri. Of course, Joplin got hit many years ago with those horrific tornadoes, and there was such a pouring of support to that community. But this one's been different because everybody's been hit by a tornado all at once. So we haven't had the cavalry that's been able to ride in and save us. So in many times I know people have felt alone or that they're just overwhelmed, and that's totally understandable. Please know we've got a great community here. Hi Mom has been putting out information since the very beginning. They're very accessible with all the social media stuff that they do. And certainly I'm accessible too. I'm here to help out. I'm here to try to make the best decisions we can under very difficult situations. So if there's anything I can personally do, and we'll review the chat, and I know we always post follow-ups and show notes and that. If there's topics we didn't get to, we'll make sure that we get those addressed. But at the end of the day, just please, thank you so much for all you're doing, and please stay safe. Take care of yourself, take care of your family, take care of the kids that you serve. But I just really wish you guys all the best. It's been one heck of a ride, and we're not quite out of it yet. But the light is coming at the end of the tunnel. A few more months, and I think we'll be in a much better place.
Andy, it's always a pleasure. A couple of people have asked, is there any particular way they can get a hold of you? Is there a way you prefer, or can we share maybe your contact information?
Sure, yeah. I mean, hit us up. We're on Facebook, Institute for Childhood Preparedness. I'm on Twitter, Andy Roszak on Twitter. Go to our website, drop us a line. We're very accessible. We're here to help.
Andy, always a pleasure. A couple of great shout outs before we tie up and just get everything rock and rolling to end for today. But a couple of shout outs. One of them here from Laura. She had this awesome quote: is if you don't pick a day to relax, your body will pick one for you. I totally agree. Take your mental health day. Everybody, you guys have been doing such an amazing job supporting the entire world wherever you are right now. You guys have been doing great. So keep up all of the good work. And Christy, you said your pediatrician says that about 2 weeks before Halloween is optimal for getting the flu shot. And that's when the germs are definitely spreading, and highly recommend. So key takeaways for you guys today is, just stay healthy. It's not easy right now, and do your best to stay healthy. Certificate, folks. This is always the big question. It's here. It's available. Carmen's going to make it available here for you. But you can go ahead, you can download it. It's under the file section here. But as well, just download it, pop in your name, your center name, you're done. If you don't get a chance to get it today, it will be in the show notes tomorrow. So do not worry. Andy as well is sharing his Facebook information in there. I see his email. I think it was his email. His website title, everything is there. We'll make sure as well to include everything in the show notes for you if you don't get a chance to grab it. So don't fret there. Next week, we're bringing on a couple of fantastic webinar people who've been with us pretty much. I think they've been with us for like almost the whole time. So we're talking about surviving and thriving. Some of the good things that have come out of COVID-19, because there are some, folks. They definitely are some. But join us next week, same time, same place. If you're on your same spot on the couch, don't fret. We'll be here 2:00 Eastern Standard Time as always. And as well, if you're looking for Hi Mom on social media, Miss Kaya's out there. She's looking for you. So don't be shy to find her. Find us Hi Mama on Facebook, Hi Mama app at Instagram and Pinterest. And as well, you can pop on to himama.com if you are looking to learn a little bit more about us. And Carmen's just told me that both of our special guests are with us for next week, but I'm not going to spill it yet. Okay, guys, I like to keep it till the morning of, but even though I know you guys know in advance, but super excited to have them both on. It's going to be fantastic. I'm really pumped. At the end of the day, Andy, thank you again for joining us. I love chatting with you. It's so inspirational chatting with you. We're going to definitely, let's say 6 months from now, right before your wife's due, let's bring you back. That's not 6 months out though. We'll do it after, and then we can maybe get a baby view. All in this together, folks. Another key takeaway from Andy is that we're in this together. We're all riding in the same boat, just in different locations. So stay healthy, stay safe. Carmen, is there anything you want to add before we sign off for today?
Just wanted to say thank you, everyone, for spending some time with us. Thanks to Andy for sharing his wisdom with us. As always, we really have to make this a regular thing because I love the energy. And stay safe. I think that's the biggest thing that we need to prioritize right now. We'll see you next week.
Agreed.
Bye.
See you next week, everyone. Bye.